Hi there, my name is David Coletto, and I'm the Chief Executive Officer at polling and market research firm Abacus Data. It's a pleasure to be here with you today to share some new data that we conducted on behalf of the Canadian Dental Hygienists Association. I'm just going to share my screen and we'll get right into it. This study conducted earlier this year explored how Canadians are thinking and feel about the state of oral health for seniors and older Canadians across the country. In particular, we were interested in understanding what Canadians believe the federal government's role should be, and as it starts to develop national standards for long-term care, what role oral care should play in those standards and whether they should be included or not. Let me get into the details. Now, this survey was conducted at the beginning of the year. We interviewed 2,200 Canadian adults from January 7th to 12th, 2022. And this survey had a margin of error of plus or minus 2.2%, 19 times out of 20. Now, this is a representative sample. We made sure that it matched the Canadian population based on age, gender, region, official language, and educational attainment. And here are the key findings. First, we found that most Canadians believe that the state of oral care for older Canadians and seniors is a problem. I'll explore that in a little more detail. Now, almost half think that oral care services in long-term care facilities are basically non-existent or minimal. Canadians are also broadly supportive of federal funding for preventative and basic oral health treatments for low-income seniors. And we find that almost all Canadians, as close to a consensus as you can get, 88% think it's important to have oral care included in national standards for long-term care as the federal government follows through on its election promise to set those national standards. So let me get into these results. So in the survey, we asked Canadians thinking about the oral health of older adults and seniors, to what extent do you feel each of the following is a problem? And they were able to rate that from a very serious problem to a minor problem to not at all a problem. You can see that on every item that we tested, almost or well more than half felt that this was either a very serious problem or a serious problem. Things like financial constraints faced by seniors that makes it hard for them to pay for oral care. There we have a clear majority, 80%, who think that it's either a very serious or serious problem. A lack of adequately funded programs for seniors to support their oral health. 72% believe that is either a very serious or serious problem. Restricted mobility to physically attend appointments. Lack of awareness of the importance of oral health to their overall health, lack of education or awareness on proper oral health care for seniors. We find anywhere between 57 and 64% thinking that's a serious problem. And then lastly, difficulty finding dental or dental hygiene professionals in their communities. Less believed to be a problem, 45% believe it's a problem, 19% don't think it's a problem at all. So, access to a oral health professional, maybe not as big an issue as having the money or the ability to actually access those health professionals. But the story here is, by wide margins, most Canadians believe there is a problem here, and therefore there's a role for government in trying to solve it. Now, one of those problems is specific to the long-term care facilities, and we know that the pandemic has really put a spotlight on those long-term care facilities. And so when we ask Canadians, which of the following best describes your impression of the current state of oral health services in long-term care homes, most Canadians aren't giving it high praise. Only 7% described it as either good or excellent. In fact, almost half said that it's either minimal, or 16% described it as non-existent at all. Now, there's a large number of Canadians, as you might expect, 31%, who are not sure. And that gives us insight into the fact that even if they lack understanding, they are not willing to give it good marks, which suggests there's probably some skepticism. Now, when we look at these numbers across the country by different demographics or even by political group, one of the things that stands out is that there's not a lot of variation, that whether you live in British Columbia, Ontario, Quebec, or Atlantic Canada, you are not either certain or pretty skeptical about the quality of oral health services in these long-term care facilities. Similarly, when you get older, across the age groups, we find that older Canadians are more likely to say that these services are not there, or they're very inadequate, which suggests that as you get closer to the age that you may be in these long-term care facilities, or you have more experience in them, maybe you have loved ones or you're a caregiver, your view of those services declines substantially. We also don't find a whole lot of difference across political group. Those who voted Bloc, Green, or NDP slightly more likely to believe these services are non-existent or minimal. But again, that's just a difference really of degree than of direction. Now, when we ask people to think of some solutions, well, one of them that almost everybody agrees on is the fact that the federal government could and should support oral health and preventative oral health services for low-income seniors. We find 86% support, including almost half of Canadians who strongly support this idea, and almost no opposition. So this is an idea that finds broad support and very little resistance. In fact, when we look again across the country at different age groups and across the political spectrum, we find that there's very little regional variation. Those 60 and over are far more likely to think or support this idea, but so too are younger Canadians who see the value of good oral health. Similarly, whether you're a conservative supporter, a liberal, New Democrat, you're getting very broad support. In fact, among conservatives, where you might suggest there might be some opposition because of spending or pulling back spending, only 9% of those who voted conservative oppose this idea. Finally, as the federal government looks to develop national standards for long-term care, we wanted to know how important Canadians felt that oral health and oral care be included in those standards. And what you can see here, again, is almost a consensus, with 88% of the public believing that they should be, that it's either very important or important for oral health care of seniors to be included in these national standards. Only 4% do not think it's important. And so that is, again, as close to consensus as you get, and we see similar numbers across the board. And so the big picture here is that people, I think, recognize that there's a problem, that the services at long-term care facilities are minimal. Those who have an opinion think that they're either minimal or non-existent at all. Very few give these facilities high grades for their oral care services for their residents. And as we move forward with setting national standards, it's clear that Canadians believe that oral care should be a key component of those standards. If you've got any questions about this research, feel free to reach out to me at david@abacusdata.ca, and I'll see you next time when we do some more polling with the Canadian Dental Hygienists Association. Take care.